Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Parimala Devi, a renowned gynecologist and obstetrician. And she is expert in colposcopy as well as the robotic surgery. And she has set a world Guinness record in screening the CS cervix patients. And she is going to talk to us about the D and C. What is D and what is C? Please tell us whether you do it in the local anesthesia or general anesthesia. Please let us know.
Namaste, madam, and my respectful pranams to you. My teacher was in college and always my teacher and in my life also. And so because of the popular channel which I like to see, which I miss it if I don't see 2 days, is that Adhyatma, Arogya, and also about the Ahara, the food, philosophy, and also about spirituality. So today's this topic you have chosen, I know very well. We are all rushing towards robotic and laparoscopy, that this in infertility in gynecology. But as a teacher, you are telling us the basic thing, roots don't forget. That's what I have liked about this topic. The commonest procedure I can say, dilatation and curettage. What is this procedure? Why it is called D and C? Because you know that the uterus has got the body and the cervix. So this part, this is what is called as vaginal canal. This we are not doing. We are putting an instrument. We are dilating the cervical part, that is about only 2.5 to 3 centimeter.
The opening.
Entering the cavity through a very small, delicate instrument called curettage. Dilatation is done by some dilators which are well tested, and also by the curettage. The dilatation and curettage procedure is so popular, means from our days of college days.
I
As
know. Even for 50, 60 years, that was the common procedure done by any
yes,
gynecologist.
yes. One this procedure we would be allowed to do in the beginning to give some chance to us. Oh, this girl is working very hard. That is DNC. They know that it's a small procedure. Let her do and learn the thing. So
Even, but that
dilatation
is
is
also not very safe. Sometimes
very
they can
safe.
perforate
Yes,
while doing the
yes,
curettage,
yes. That
I
is
have
very
seen that
important.
happening.
Yes, yes, that is there. So dilatation and curettage is one procedure, especially a lady may come who is just married and she is having severe dysmenorrhea. She is unable to tolerate. Maybe there may be so many reasons, but that time also we usually think, is there any cervical? The cervix is very small. The mouth of the uterus, whether it is very small. The second point, a lady who is married trying for pregnancy is coming, but she is not delivering. So many criteria are there, but everything is normal with husband and wife. But when we examine her, her cervix may be very pinpoint. We say like a small hole. There should be a hole in the cervix actually, like this. See, like there should be, but it may be very
Yeah.
small. So the semen may not be entering and going and catching up with
Ah,
the egg.
the sperms are not able to enter because it is very
Enter,
narrow.
enter.
Ah,
So
and
that
that's
time
the reason
also,
they are not conceiving.
yes, that maybe one reason. So usually we
Hmm.
dilate and observe them for some more reason. So this is one thing. And another important category where we usually use this as our called as Ramabana or whatever you say is by the 30 to 40 years reproductive age women. Lot of hormone profile surge because they are delivering, they are aborting, they are having some copper tea for the family planning. So many things go in this part of the age group for a woman. It's the peak
Hmm.
reproductive age group for them. That time also we use this procedure. One, she might have had pregnancy without her knowledge. A married lady, she might have lost her
Okay.
pregnancy. Her cycle she thinks irregular, but it may be abortion, a small early
Okay.
abortion.
Okay.
That time her bleeding is not coming under control and she looks very pale because every day she is bleeding. But she has
So that
forgotten
is a threatened abortion. Threatened
threatened
abortion.
abortion or it may be incomplete abortion. She thinks it
Incomplete. Okay.
is
Okay.
menstruation,
Part
but
of it is
actually,
gone and part of it has remained there.
yeah. But she
Okay.
has not made out in her busy life of taking care of the children. She won't even remember her last cycle also. That happens with so
Hmm.
many women because our Indian women are very appreciable, dedicated housewives also in our country. So because of this, what happens when they come, when we do our GPS, I told you last time, our scanning, so ultrasound, when we do, then it will take us and tell us there are some baby pieces, products
Part
of
of it is left. Okay.
that time our immediate action is to do this DNC and to suck out. Actually, should be called as suction and evacuation. When there is an
Okay.
abortion,
Suction and evacuation.
we use the suction
So,
there. So for aborted products also, this is a one important. And this hormonal profile of some women at 35, 40 may be so much fluctuating. So it is very
Mm.
difficult to whatever tablets you give, they may not be this one. Or sometimes they may be very obese, overweight. Or they may be having some small cyst, because of that they may be bleeding. But to understand what is happening with this woman, whether it is because of the hormonal profile or some pathology or just the menstruation layer has become thick because of the hormonal profile. The menstruation layer, which should be 6 mm or 7 mm, will be 18
Okay,
mm,
okay.
20 mm. So they will be just passing some pieces of
So
tissue.
that means for the baby, the fetus to lie down, a bed is made prepared.
Yes,
A
bed.
soft
That is
bed is
correct.
prepared. Yeah.
Correct,
Mm.
correct. So especially in these 35 to 40 years women, baby may not be their concern, but everyday heavy bleeding, they cannot do their puja because we have a lot of rituals in our this one. Every
And
woman
they
got
develop anemia and weakness and not able to
anemia,
work also. Yeah.
weakness, heart problems, all these things. So in that also, when we do DNC, we send part of this tissue, endometrium, to the laboratory. Our
Mm.
expert pathologist, they will tell us, they will support our diagnosis, whether it is because of some infection or because of some endometrial thickness, or there might have been some small polyps, small that balloons of endometrium which are peeping out. They all maybe sometimes fibroids also may come out, small small fibroids.
Or
So all
sometimes even the pre-cancerous or the cancerous stage also
yes,
could be there.
yes, yes. Pre-cancerous, this one exclusively is 45, 50 years, 50 years plus women. This has got a extensive, important place actually. Without this, we are not supposed to go ahead with any hysterectomy or any other procedures. But only thing, we are in the era of medico-legal protocols now. So we have to do it under a hysteroscopic vision as far as possible, if the facility is there. If there is no hysteroscope, you can write without the hysteroscopy, we have done, but only endometrium was taken like that, we can. Hysteroscopically, when we visualize and do what happens under that vision, we can see first all this cavity very well under the monitor. So by seeing wherever there is some problem you are feeling, you can take out that endometrium and send for the biopsy. Biopsy is the ultimate, madam, gold standard. Depending on that, many treatments depend. But this 45, 50 years women, when they are about to reach menopause around 50, 51 is our average age for menopause in our Indian women. So when they are about to reach, so we can postpone some unnecessarily major surgeries like hysterectomy, unnecessarily
Yeah.
laparoscopy. These things can be postponed because only cleaning the uterus and inserting some progesterone like that, some medicated drugs will control their bleeding. They will have a very healthy life because their bleeding tendencies will come down. And another important, especially this age group, menopausal symptoms will come down. They'll be ever smiling like our madam, very happy, very calm, because that estrogen surge irritation is not there because of this
Yes.
progesterone. So there are some women which they need for
Yeah.
menopausal symptoms.
Yeah,
So
you told a
this,
good thing that the by simple DNC, you can prevent the further surgery or anything. But in
surgery.
fact, I remember I was only 8th standard school girl, and my grandmother, who was 60 years, she had a lower abdomen pain, and all the doctors, they kept on examining, and they couldn't make out anything. But those days there was no ultrasound or anything.
Yes, yes,
And
yes.
then, she was such a brilliant lady. She kept on asking me, what is here? What is there? This is liver, this is stomach, this is kidney, and this is. And then next day she went to the clinic and told them, you just look at my bladder and the uterus. If there is anything wrong, and let me know. And it turned out to be endometrial carcinoma. And then
Oh,
she had to undergo chemotherapy. This is in,
painful actually.
what to say, in those days.
Yes, yes,
I
yes.
really appreciate her intelligence
Right.
because as a school girl, I know where the organs are. Only that much
Right.
anatomy I knew, and but she decided that this is to be uterus, and this is uterus is one thing. Nowadays it is very easy, and people should take the advantage of this
Yes.
newer techniques and technologies, and then get them detected in time. And
Right.
regarding the thing you said, if they have dilatation is done, they can conceive also. I
Yes, yes.
remember my classmate, Dr. Sadia, and I had gone to her house and her chachi, the auntie, she underwent a DNC because of the menorrhagia. And the
Okay.
whole family was thrilled and they were saying Mubarak ho, thinking that she is going to conceive. So either way, whether it is conceiving or the cancer, both, one should
Yes,
be remember that
correct.
a proper curettage and the report, histopathology, that is the one which is the diagnosis. So
Yes.
how much importance do you give and how do you decide? And do you do it under local anesthesia or general anesthesia?
Before days, actually, in 3 decades back, it was under only local only because anesthesia was not
Yes,
so
yes.
predominantly available. But these days, like there are methods like in local also we can do because there is what is called as endometrial biopsy, papillary biopsy is there. Especially, I told this elderly age group of 45, 50, where pregnancy is not a concern. We can just insert it in the OPD only without anesthesia. Also take a small bit of biopsy. But sometimes that is not sufficient when there is a continuous bleeding, when we are suspecting some cancer or pre-cancer lesions. So usually under anesthesia, under the hysteroscopic guidance is the ideal. But most of the time, at least some mild sedation, but we should be doing it in a operation theater atmosphere where emergency drugs are available, anesthetist or help is available because some people, the dilatation of the cervix, even though it may not require anesthesia, they say it can create some kind of shock to the woman because of the fear. So it is under mild sedation, or these days, if at all, it can be done ideally
They
under
can
the
have severe pain when you're dilating, no?
dilatation. So because of that, we have to do it under anesthesia as much as possible, and we have to see that under the vision, if you do, it is more important so that it will help them, especially in young people where there is for infertility management and all we have to do. Then we do actually dilatation and scratching the endometrium like that. We need not take out the full endometrium because that may lead to other hazard effects of developing synec
Yes,
in the uterus. Over curettage also is one important thing I want to
yes, yes.
highlight because many people they don't conceive after this because they will have developed synec in the uterus instead of improving.
Oh,
Synec may come, so it is a correct expertise is very much required in doing an ANC, especially in infertile people. But in elderly age people, if you do little bit of extra curettage, nothing is a problem. But in young people, it should be judiciously used whenever we are doing DNC because she have to menstruate, she have to conceive, she have to have her cycles again till her menopause. So these points have to be taken importance, and a good counseling is very very important. And these days it is, as I have seen the government wing and also corporate wing, it is not that simple to convince the patient. They will doubt your efficiency and your knowledge, and they may do the shopping of Google everything. So but a good time spent and telling the examples, if you do this, this can happen, this can happen, will really give a lot of confidence to them and they will accept the procedure. So it is a
yeah.
very important basic procedure required for women in gynecology practice, done for various reasons, especially one last one, this one, a patient has delivered, she will go home and come back with continuous white discharge, foul smelling. There may be a placental, she could have
Infection.
infection because the placenta might not have come completely. Everything has been approved normally, but there is small piece which might have been left. It's not because of doctor or anybody. Sometimes there will be adherent
There is
coagulation.
adherent, it is stuck
Yes,
there.
small
Okay.
piece of placenta. That time when we do this DNC and do this under the ultrasonography guidance, where exactly it is like that when you take out, she will definitely praise you and give lot of respect because she gets all right after that. Otherwise, in our rituals of puja, part, everything, it's very difficult for a woman if she is not bleeding, if she is having unnecessarily bleeding discharge, she cannot carry out her rituals. So DNC has proved one important handy procedure for us to take care of our women population in our practice, madam. You can say.
Yeah, it is so very nice, Though it is a simple procedure, I can say that it is like grating the coconut. And if
Yes,
you
yes.
go do too much, there can be perforation. If you do too little, what
Perforations.
is
That is
to
one
be
important.
removed, it will not be removed. So
Yes,
that's
yes.
why, the expertise is required. And then how you explain is also very important. If you
Yes, yes.
want to summarize and tell a few salient
Point.
points to our viewers, please conclude how you can
Yes, yes.
conclude this importance of DNC.
Dilatation and curettage is a simple procedure. People, our women friends need not get scared of it. It is not a procedure, once it is done, it is only for getting the baby or to diagnosing the cancer. It is done in many conditions. Maybe a young lady having dysmenorrhea and she is not responding to any medical treatment. That time also we can dilate only cervix and make her actually healthy. Second point, her cervix is very much stenosed or nulliparous, pinpoint as we say. That time also we can dilate and help her to get the pregnancy because semen can enter easily. Third point, for abortions, for retained products of conception, dilatation, otherwise called as suction evacuation, has been proved very handy procedure in a very small time. And it will make the woman healthy because in the reproductive age group, women will have all these problems. Perimenopausal women of 45-50, it has got its very much a esteemed place because it can cure her heavy bleeding, augmented extra bleeding, and rule out cancers also, especially elderly postmenopausal women when there is a retention of menstruation or some secretion because the os of the cervix has got stenosed because her estrogen
Hmm.
has become totally zero level. So that time, like
Okay.
how the urethra becomes atrophy, the blood, this
Hmm.
one also, uterus mouth also can become atrophy. She can continuously come for pain, pain, pain. That time again to rule out any retention of these secretions or to rule out mainly the cancer in this age group 55
Hmm.
plus, we have to depend on this procedure. It's a beautiful small procedure done under their comfort depending on the availability of the facilities. You should take it, you should understand it, and take care of your health. That I would request all my friends here. Thank you, madam, for giving this
Thank you.
opportunity.
Thank you very much, Dr. Parimala Devi, explaining such a simple procedure, but so important and so very useful for making the precise diagnosis and giving
Yes.
the proper treatment. And thank you very much for your kind
Thank you,
presentation.
madam.
Thank you.
Thank you.